Hi, this is Kendrick with worldmedicalschool.org. We're going to talk about OCD, Obsessive Compulsive Disorder. So this affects around 2 to 3% of Americans. And the most famous case that people talk about is Howard Hughes. I don't know if anybody saw the movie The Aviator, but it really shows a lot of this pathology and how it affected his life. But the basic presentation is just people with obsessions or compulsions that lead to significant impairment. And an obsession is characterized by persistent, unwanted thoughts. So these people don't want to think about these things constantly, but they can't get them out of their mind. A lot of times they feel really guilty about what they're thinking about, especially if they're thinking about death or sex. Some of them have pretty disturbed thoughts about sex, including incest and rape. A lot of people have kind of blasphemous religious ideas. If they are religious, they think about blasphemous things, cursing God and doing blasphemous things at church or during other religious services. That people say that Martin Luther had obsessive compulsive disease, and he kind of was obsessed with the devil's behind. I don't know where they got that, but it's pretty interesting. And then the compulsion side is the irresistible impulse to perform an act. So a lot of times these are going to be associated with the obsession. You know, if they're obsessed with cleanliness, for example, then their compulsion will be to constantly clean their hands, and that act or that ritual will help them to relieve some of the anxiety that is caused by their obsession. Some of these compulsions, though, are not related to the obsession. They can just be completely unrelated compulsions. But a lot of these include, for example, sex again, hoarding. One thing I thought was interesting about obsessions that I missed is the hoarders sometimes feel like these inanimate objects have rights and that they cannot be thrown away because of the rights that they have. And they know that's illogical, but they still do it anyway, and they feel like they have to do it. Presents in late adolescence and early childhood most of the time, but equal in men and women, and it's usually pretty resistant to treatment. So on your differential diagnosis, a lot of people talk about OCD in the way that really describes OCPD, which, let's see, for example, people say, "Oh, I'm so OCD about this," and a lot of times they're really kind of bragging about their commitment to order or the religious way that they do something. But the real difference here is that somebody with OCD would not be bragging about their disorder. They feel bad about it a lot of times. They feel anxious about it. It causes significant impairment in their life. Now, some people who say they're OCD mean that they really are careful about their work, whereas obsessive compulsive disorder, they are careful about something enough that it would destroy their work. You know, they wouldn't be able to get anything done because they're focusing on one specific thing. So the obsessive compulsive personality disorders, they usually feel pretty good about their obsessions and their compulsions, and it's not nearly as destructive as the OCD. So first line treatment is described in some sources as being pharmacotherapy. Some studies have shown that CBT is actually more effective than pharmacotherapy, at least in patients that don't have comorbid conditions. And there's a specific type of CBT, which is cognitive behavioral therapy, called ERP, which is I just had it in my mind. ERP means hold on, let's see if we can find it. Sorry, this is really okay. Exposure and ritual prevention. So the and yes, I did just look up a Wikipedia page, but I'm also using other sources as well. So exposure and ritual prevention is the specific type of CBT that helps with OCD. And pharmacotherapy, SSRIs are first line. Clomipramine is also used. And as far as antipsychotics go, you can use risperidone, haloperidol, and some of the others that there hasn't been as much research on. But these are more for the refractory cases or the cases that have a psychotic element to them. And back to presentation, there are a lot of these that are hard to differentiate from psychosis, just because their beliefs about these obsessions or their compulsions can be just delusional enough to be confused with psychosis. So it can be a little bit of a fine line. But as far as the Dsm-4 criteria go, basically if you have these obsessions and compulsions, if you have a disease that is characterized by impairment because of obsessions and compulsions, they call it OCD, unless you meet all the criteria for schizophrenia or other diagnoses. ECT is also used, and patient education can be helpful as well. Please comment below and help us to make these videos better. And if you want to do other things to volunteer, you can email us at volunteer@worldmedicalschool.org. We could use any type of designer, programmer, as well as anybody with medical knowledge to help compile these videos. That'd be much appreciated.